It's 3rd of February. It's now 11 o'clock, 11 p.m. in the night, and we are outside IPHB, Bamboli. That's it. And we have come here as one of our inmate has gone out of control, and gone out of control in a very bad, severe, or complicated manner, lady inmate. And now we have brought her to the hospital, which may take another 1 hour. We came here at 9 o'clock. Now it's 11 o'clock, and they are moving the paper as if it's a government department and they don't know who we are, so that's okay. See, we are not here to waste our time. Neither are we here to make time pass. Okay? Government has two options. Either you all work with us and help us on this point, IPHB part. We are talking today about IPHB part. Okay? It is 2 hours now we are come here. That doctor is a junior guy. He is asking 25 questions. When am I going to finish that work? The patient is a chronic patient of this hospital. Some time back, they were also troubling us. We made some noise that are not troubling. Now they're troubling the poor people. We are demanding that there should be no caregivers forced to stay with the poor people who bring their relatives for admission here. After the Prime Minister leaves Goa after the 6th, if Guru Pavaskar, the Disability Commissioner, does not solve my problem, I am 100% saying we are going to go with as many patients as we can. First to Director of Health Services, asking the current director why the order is not implemented of sending the doctors to our shelter home, which is nearest to the health center, when there is an order. Second thing, we are going to come to IPHB and find out from whoever is there why you are discharging patients so quickly who are admitted, why you are forcing and implementing a rule that our local Goans, poor Goans from the villages who want to get admission into the hospital because they have blown their tops, have to keep a caregiver. What does that caregiver do? Sometimes their relatives sit here who are 70, 60 years old. They cannot do anything. The point of discussion is this lady is a Goan. She's an unwed mother having major psychiatric issues before she came to us. That is before 3 years ago. And I think so in the last 12 months we must have brought her at least 6 times. Especially night time she trips, she goes out of control, and admitted her. And doesn't seem to be stabilizing because it has been chronic for maybe 7, 8, 9, 10 years. I'm not sure how long this case she has been going on. In such situations, what do we do? Today she assaulted the caregiver. She got very violent. She's on medication. Everything, her follow-up is normal. There's somebody monitoring her. Otherwise, she's very peaceful. Now we are having close to 60 lady inmates, which even this hospital at any point of time will not have in the ward. And even only maybe I am given to understand that Provedoria has one home for such ladies, and they may be having, if I'm not mistaken, 35 to 40, maybe more. Now we cannot take this lady back to our home, that's for sure. So she'll have to either stay in the hospital, or she'll have to be sent to her home, or this hospital will have to send her to Provedoria. Now usually government gives some facility to Provedoria which we don't get, and that includes the psychiatrist who visit Provedoria. So if we are going to take all these chronic cases and being paid by women and child at 2,500 rupees or 5,000 rupees and run around with them in the night, and hospital thinks that we are the dumping ground, or we are the last stop for such people, then we would like to change that perception. So either the health minister Vishwajit Rane understands what I am saying, or the HOD here, who's Dr. Anil Rane, he understands what we say, because the time will come if we don't get the same treatment what the government gives to Provedoria, where mental health facilities are given, then either we'll be forced to bring all our 150 to 160 people here one day and crowd this hospital and make an issue, or we'll have to shut down our homes peacefully and put these people back on the street. Okay, now recently we had an issue with women and child, and CM has looked into the matter. Now I complained to Disability Commission of last week. He promised to look into the matter, but he's not looked into the matter. So if every week I am coming at 10 o'clock, 11 o'clock, 12 o'clock in the night with one woman patient from my home because they are highly chronic and very volatile, then it's quite tiring, it's disheartening, it's painful for us, for me especially. But the patients who are in Provedoria, I don't see any Provedoria vehicle here bringing their patients and coming. So definitely IPHB is sending their doctors to Provedoria. We are demanding, or I am demanding at this point of time, at 11 o'clock in the night, that I am losing my patients. Okay, either Vishwajit Rane as the health minister. Okay, see boss, you are not doing us any favor, neither are we doing you any favor. It's a service. If you don't get this facility within this month, okay, don't ask us to write any emails, send letters and all. We are using this message to tell you, was treat us on par with Provedoria, where the facility of health care by the psychiatrist is provided to us, because we have close to 155 psychiatric patients which even Provedoria will not have, and any point of time even IPHB will not have so many patients. Second thing, we have an order by the health department, director of health services, issued on an official letterhead where the government doctors are supposed to visit our home every 15 days, which has not been implemented. Okay, so my patients or my attitude has got nothing to do with this. There is a limit which I can go to. I am also a human being. Okay, if the order is issued on a paper of the government signed that all our homes should be visited by the doctors in the primary health center which is next to our home, if it is not being implemented, sir, please look into the matter. Don't make me come to the streets again. Okay, this trouble we cannot accept anymore. We are the solution to your hospital here. Yes, your hospital is keeping people here for 15 days. We are giving them permanent care. Now, if the permanent care you are paying, one department is paying us 2,500 or 5,000 rupees, then either I don't know numbers, or somebody thinks no, this will go on permanently. Artha Sang, you are now seeing me last 6 months. You are coming to my home last 6 months. You tell us what you feel you have understood.
Yeah, it looks like the Street Providence is getting some very basic treatment, while the Provedoria is getting the high class treatment. That could be one side of it, or it could be that Provedoria is just taking inmates which are actually not so severe, like the cases that we are handling. So they are given some very mild, very patients which are much cooler than what we are getting, and they are dumping all the bad patients to us and giving us more trouble. It looks like something like this. The government needs to probe into why people are suffering like this. What is the reason? It is not us who can do the research. It is the health department, the doctors, the researchers that can find reasons why these things are happening, and curtail it at the very beginning before it reaches a stage like which you cannot handle. So I mean, I can certainly vouch for Donald, who says that he's getting the bad treatment, because giving an allowance which is not really worth the time, the energy, the space, the type of treatment that we give, that Street Providence gives, is completely unmatchable to the funds that are being dispersed by the government. So it's high time that the government awakes and does what it is supposed to do.
Another thing I want to tell on this video, see, um, don't make us come to the streets again and again, okay? We will be approaching, if I don't get any solution from the health minister, I'm not writing any application. After the Prime Minister leaves Goa, we will be either one day at a health director of health services in Penjim with whatever people we got and the order which is given to us, and next day we will be in IPHB. Here the doctors are telling me, when I'm coming to the hospital, telling me on my face, take the medicine and go and bring them after 5 days. I'll give the challenge to any HOD, to any consultant here, run my home the way I run, okay, and tell me whether you can manage the way. You all sit here in a government hospital with all the bloody facilities. You have ward boys here who are idle. You make people pay caregiver charges for the poor people. Huh? Why you have ward boys here? Every time we have to come and shout here at them and use influence and call this minister and that minister to admit. What, these are our personal relatives or what? Why are ward boy? Why are the poor people made to keep a caregiver in this hospital to look after a patient when they can't afford? If they, I have given an assurance to HOD. If there are any Goan patients who are abandoned here, you send them to me, I'll take. Caregivers are there. Caregivers from outside are charging the poor people money. If somebody wants to address the issue before I hit the streets. This is not going to. This is getting out of control. There are enough of people of Goa, ethnic Goans in all the villages going through this mental disability issue. There has to be some consideration, especially towards street providence. They treat us like we are some chiller here. But when they want to recommend a patient to us, there's a different approach. When we come back, we have to stand and listen to their crap stories. But if the minister calls, these guys dance. So we have to go to the ministers, to the MLAs, use influence to admit the patients who are not related to me. And then you will admit. So you have two sets of rules for admission. Every time I have to come here. This is my time to come at 11:30 now or 11:15 now. These doctors cannot be briefed. Purposely we are bringing people because we got no work in the night to admit. If you think that we will come one day with 150 people and jam up the hospital, and then you will understand. Your OSD does not lift my phone. Your PA does not lift my phone. People there think that they own the department. If I make noise, you try to take revenge. You have any idea what is the status here? Half of you all of the department think you all own the department. You do man like this social, you do one home. I'm waiting to tell one doctor or two doctors, run my homes the way I run without government support and look after so many people. I'll give you medicine, you don't bring them here. Easy to sit on a chair with all your facility you have, twiddling your thumbs and making the poor people cry. I'm not saying the hospital is not giving facility. I am saying everybody is stressed. The way the doctors and the system is stressed, people also are stressed outside. Poor people also are stressed outside with mental disabilities. So who is the solution? Who is the solution to this problem? I am coming my way. Is the hospital coming his way? Is the health department coming their way? Everything here is personal vendetta. Because Donald is making noise, we'll show him afterward. Baba, don't threaten me. Okay, and I'm not threatening anybody. I am doing a service. If my services are not required, I am saying again, shut me down. Take all the inmates and go. We are not interested. Tell your hospitals, don't recommend them to us. Nobody is begging. But treat us on par. If you want our services, treat us on par with Provedoria on this point, where we get the same medical health facilities which Provedoria gets. Provedoria got 240 patients today. I have 180. Provedoria is government, semi-government autonomous. We are private. We are chiller NGO. Okay, so government should give us more to what Provedoria is getting. This cannot go on. Vishwajit Rane as the health minister, the health secretary Arun Kumar Mishra, the director of health services Dr. Geeta and Dr. Anil Rane. If this video reaches you all, and Guru Pavaskar Disability Commissioner, okay, I will wait till the Prime Minister's visit has come and gone, and then I will hit the streets. And then don't get offended, okay? Don't get offended. Don't take offense. My problems have to be solved. Again, I'm saying you either shut me down fully and we get out of this line systematically and just go away. Let the poor go wherever they want to go, or give me what is on a paper. I have an order. I have an order signed by the previous Director of Health Services which clearly states that every 15 days the nearest primary health center has to visit my home, which is not being implemented, and that's the state we have reached today. I am not come here at 11:15 to eat your brains up and my brains up. I am come here because the government is not giving me the facility to look after poor homeless Goans suffering from mental disabilities to what was supposed to be given to me, and that is in the mental health care problem which I am facing. There are many problems, and most of the problems come under Vishwajit Rane. I am not somebody who is going to sit quiet, or neither am I going to be somebody who is going to get frightened of somebody else. I am doing a service, black and white. I know one day they will target me, come with some racket and story. That is okay. That is their tricks of the trade. That we understand. But this nonsense cannot go on. There are no shelter homes for poor Goans suffering from mental disability free of cost. Besides Provedoria, can they handle 150 patients of mine? Take all of them and go. Finish. You don't require me. I am free to do whatever I want after that. I can relax peacefully. I can convert my 240 beds into paid. 25,000 rupees per patient I can charge. That is 60-70 lakh rupees. Why I want all this headache again and again? Every day I have to fight with somebody here in IPHB and grumble and threaten them. Where is the respect we have left? So, it is now, we are in the hospital. This has to stop. I should be treated with respect. I should be given my share of the value, especially when we bring a patient in the night and we know the patient has to be admitted. It should be done in the shorter span of time.
Correct.
Because we are not coming here every day.